I feel very motivated now and very ready to share with the staff and the other team members on how we can make these improvements to better satisfy the patient's needs.
But I think it leads to more camaraderie and people working together. I think that can only benefit the hospital.
I think it's a wonderful thing that you're just trying to make a place that's already really, really good or great. You're just trying to make it awesome.
You get to exchange ideas, you get to disagree, agree to disagree, but the idea is it becomes like a think tank and you actually get to put things into place, implement it, and do a follow-through.
I think the process is good, and I think the process is long overdue in the healthcare industry today. We need reform, and there's no better place to start than right here where you work on a daily basis.
We didn't actually walk in the room with the name Breakthrough. That was a committee that was formed at HHC, and they actually came up with the Breakthrough name on their own, which we really thought was a great idea that HHC had come up with because they were really looking for breakthrough results.
Breakthrough is intended to be the improvement methodology that we use across our entire system for all of the work that we do, whether it's the direct delivery of clinical services or whether it's materials management or whether it's reimbursement and collection of the revenue that we should be collecting. It has universal application, and we're seeing it now used by teams across our entire system in all of those value streams.
What we find incredibly exciting about Breakthrough is it will allow us to use our best assets, the people who know the work, the folks throughout the organization who are actually doing the workflows, who are doing the billing, who are the folks who are working in the clinics, who are registering the patients.
Those people know the jobs better than anybody.
When you have folk that are at the level where the work is being done, coming up with solutions for an organization, it is so powerful, it resonates throughout the organization.
The energy, the creativity, and the brain trust is in the 40,000 plus people who work for this organization. And we began to see that in the rapid improvement events that have taken place through Breakthrough.
A rapid improvement event is typically a 5-day improvement process where you start identifying what the current state is, what the issues are, what can be improved, and by the end of the week you've actually designed and implemented improvements to that process.
Okay, what other ideas do we have?
And what it actually does is improve the system using your ideas and the ideas of your team members. And it helps you to look at a system with new, fresh eyes.
The best part about Lean is that the solutions are coming from the staff itself. They like the camaraderie, they like the fact that they can interact, and the fact that administration is listening to them.
To me, the best thing about it, it involves people from the grassroots. So it's really starting from the bottom up and involving the people on the front lines try to make the system better.
I know a lot of my coworkers always say, you know, they should do this like this, or they should do that like that. Well, if you go to Lean, you'll be able to express your ideas. You'll be able to come back and maybe implement some of them.
We've got the waiting room, we've got a psych eval by a licensed PhD or social worker.
Breakthrough work is not easy. You really have to get into the detail of the work, and you have to be open to thinking about or seeing things in a different way. We have teams who start out listing what the current situation is, and then they're challenged with what would be the ideal state, and folks get excited about that.
A physical improvement would be to reorganize how we stock our supplies and keep them and right now.
None of us knew each other. I mean, I work in the laboratory, and I've been there for several years, and I would see people coming and going in the hospital, and you recognize their faces, but you've never actually worked with them. So I think working with a diverse workforce, with people who come to the group and each one making a different contribution to that group, has been a wonderful experience for me, both personally as well as professionally. I've learned from them, and they've learned from me.
And this is what you call a step counter. I feel personally that I am contributing some of my expertise to the rapid improvement, and it's going to be carried out down the road in the future.
We actually had a PED meter, and it's something that actually calculates the number of steps that are taken by staff going back and forth looking for the supplies that they need.
I have my nurses all over the place, just where can I get stuff? So right now we organized it where the nurses will be able to get everything from this room, that room, and the other room.
Now the nurses doesn't really have to run around, scrounge around to get this or get that. It's there.
So now that the supplies are accessible on both ends of the hall, she can get it and get right back to her patient right away. And that's what we were really trying to decrease the amount of time she was away from the patient.
We have different disciplines as far as your RNs, your doctors, your social workers. You have a team of people getting together and discussing their part of the process.
That's why it's so important to have a breakthrough process, because it gives you the opportunity to meet people that are working different levels of the care of the same patient.
Everybody's called by their first names. No one's there with their title, and everybody's coming up with ideas just like you are.
My why is really in the morning. Why don't we have it at the end of the day?
In the beginning, when I went in and I see an executive, I see a deputy, and I see upper management sitting there in the room trying to make decisions, I'm saying I should just be quiet and sit here and not make no comments. But then when I saw that we were all equal together, and working together and making solutions, it was great. Then I started opening up and I started talking to them and letting them know how I felt as a hospital care investigator, what could help the patients, what could help our co-workers, of all the repetitive steps that we have been doing. How could we make it less and have more time for the patients that we service in our community?
I think actually my managers were more intimidated than the labor force. It was a lift because people are inclined to try to control things, but given some of the outcomes that we've had, our managers have actually really embraced lean, and so I think we're headed in a very good direction.
I've been so impressed with what the team's accomplished at the end of the process. I mean, it's just remarkable, and it really demonstrates the power of the breakthrough approach.
HHC is doing a phenomenal job.
We have statistics to prove that we have saved time, we've saved a lot of different steps, we've made our operation a whole lot more successful.
The smile that the patient has when they're walked out of the hospital and their treatment was just the way it's supposed to be, it's the quality of care and the importance of the patient satisfaction that matters.
I think it's absolutely essential for employees to be invested in the success of Breakthrough. I mean, we're facing very challenging times, as everybody knows. And part of our strategy going forward is to demonstrate that we can not only render care that's more effective and that's more safe, but we can render care that's more efficient at the same time. And Breakthrough is a way for us to do that by adding additional value, by streamlining our operations, by tapping into the creativity and talent of the people who work for HHC, who have the heart, who have the compassion, but also who have the experience and the talent to really meet the needs of our patients in the best possible way. And Breakthrough really does try and empower them to do the improvement work throughout our entire organization. And it really will help enormously in terms of addressing those fiscal challenges as we go forward.